Hello, this is Connie Welch with LifeBeyondHepatitisC.com. I wanted to go ahead and give you the week 15 update for this triple treatment for hepatitis C. I have been using the protease inhibitor Incivek, which is also telaprivir, and also PEG interferon and Ribavirin. Right now, I've been approximately off the Incivek leg of the treatment for about 7 weeks now. And I've had two non-detected virus load tests at 4 weeks and 12 weeks. This next week, I will be doing my next virus load test, and if that test comes back non-detected, my doctor has told me that he will consider my treatment completed at the end of September, which that means that I've been on treatment for a total of 24 weeks at the end of September. I'm trying not to get hyper-focused on that date just in case something happens and the doctor determines I do need to go a little bit longer. So, you know what? You just have to take each step, each day, and each week at a time on this treatment. But the good news is it is working. And it has really been a real plus because, you know, with all the side effects issues that you have to deal with this treatment, it sure is nice when you get some good news back from your blood work. But the blood work issues that I've had this last week, I wanted to go ahead and kind of fill you in with what's going on. My white blood count is slowly going back up, so I can actually be out of isolation right now, which I'm very glad about because my white blood count had dropped very low into a danger zone, and the doctor wanted me to use extreme caution and not be around anyone for danger that I would catch something very easily with a suppressed immune system. But now I can get out, so I've never been so glad to be able to go to the store before. So it's nice to be able to get out and do a few things. The other thing is my red blood count has also been going back up, so the Procrit injections definitely are working. In fact, I didn't take a Procrit injection this last week and probably will not this week, but probably will continue the following week. So that has just been very helpful, and I have seen an increase in my energy level with that. The mystery that we've had with the alkaline phosphates going up and down, we think there is a solution to this. I had to go to my liver specialist this last Friday, and he has determined from looking over my blood work over this last year and seeing the trending of my alkaline phosphates going up and down and increasing my liver enzymes going up and down when this happens, along with an MRI that I had done last summer when I had become very, very sick, shows that the bile duct has got a slight enlargement, along with the extreme pressure that I have been feeling under the right rib cage and discomfort that I've had. They have determined that they think I have either a stone or sludge in the bile duct. I'm going to have another MRI done very soon, and that's been scheduled, and more blood work to determine if this is in fact what's going on. The good news is that there's medicine to help dissolve stones and sludge in this area, so I may be starting that very soon, but I will keep you updated on that. But the big thing I want you to understand is that this is not treatment related. This has nothing to do with the hepatitis C treatment and nothing to do with the hepatitis C virus itself. This is a totally separate issue that I'm experiencing right now. It just so happens to be going along at the same time as the treatment. But you know what? As my brother would say, that's just adventure points. So you just have to see something for what it is and just go forward. And that's what we're doing. We're just continuing the climb on this journey and just going forward. So I'm not going to let that stop me. Just keep going on, and grateful that they are finding out what's going on. So that's been good. Continue to be dealing with still the low fatigue, especially this last week. I intended to do a video blog this last week, but wound up was not feeling very good and just had to lay down a lot. And then toward the end of the week, my energy level started getting a little bit better. And again, that is something that just goes along with the treatment, that energy will fluctuate. So just because you're feeling bad or having a bad day or a bad week does not mean that's what you're going to be feeling the whole time. You just have to be patient enough to ride it out, to get beyond that moment, so that and know that you will. So that has been very good to just to keep focused on that.